Madam Speaker, and honourable friend for Calgary, I'm wondering, as a proud Albertan, she has thoughts on the Premier's recent proposal around immigration as a referendum for Albertans, since it touches on today's question. I'm baffled by the fact that she was encouraging more people to move to Alberta with Alberta calling, and complaining that the federal Liberals weren't doing enough to get immigrants to Alberta. If she has thoughts on this as a proud Canadian and Albertan, I'd be grateful.
The honourable member for Calgary Nose Hill.
Well, the member opposite who asked that question supported Liberal policies that put an undue burden on provincial governments. When Liberals brought in too many people too fast for housing, healthcare and jobs to keep up, what happened was the provinces ended up shouldering the burden of a lot of the social costs to that program. In fact, my colleague who sits on the Health Committee, who is about to speak, actually asked the Immigration Minister if she even bothered to consult the provinces on the cost of healthcare related to their mass immigration numbers, and the answer was no. So, of course, because the Liberal government haven't enacted common sense proposals like this one, the provinces are going to start coming up with solutions on their own. This is really about the need for the Liberal government to adopt proposals like ours, which are constructive and designed to restore order and fairness to Canada's immigration system.
The honourable member for Calgary Prince George.
Thank you, Madam Speaker. Thank you to our honourable colleague for the work that she's doing on this this issue. Nowhere is this felt more impactful than in our rural and remote communities. You know, over 6 million Canadians are without doctors. In our province of British Columbia, we have emergency room closures. We have OBGYN teams that are absolutely abandoning our communities, where pregnant women are forced to go to great distances to get help. Through you, Madam Speaker, I want to ask our honourable colleague, that's almost $1 billion that has been spent on illegal immigrants and what have you. That money could be spent and do incredible work in our rural, remote, but not only on my, also on my file of recovery centres for those facing mental health and addictions. And I wonder if our colleagues got a comment on that.
Honourable member for Calgary Nose Hill.
Here's the thing. The Liberals brought too many people in too fast for healthcare to keep up. So, you know, when you look at the delta between federal government spending on healthcare and the amount of people that came in, it doesn't match, right? And we found that was validated by the fact that the immigration minister said that she didn't consult provinces on the cost of healthcare. So what needs to happen, our proposal today is step number one. Failed asylum claimants should not get premium health care compared to what Canadians get. They should have access to life-saving care only, and then, as the law said, they should leave Canada. There shouldn't be costly bureaucracy set up, and we have to get back to focusing on Canadians and those who pay into Canada's healthcare system. Thank you.
The honourable member for La Pointe-Lille. Thank you, Madam Speaker. The issue we're experiencing at the moment stems from the fact there was an explosion in the number of asylum seekers, and processing is unacceptably slow. There are countries where they've been able to reduce the time it takes to process a claim. In France, it's under 6 months. In Germany, it's under 8 months. Should we not start by focusing on putting more pressure on the government so that we can have a government that organises itself to reduce the time it takes to process an asylum request? Should we not start there?
L'honorable député de Calgary Nose Hill.
2 points. First of all, we've seen that the government's efforts to, quote, expedite asylum claimants means rubber stamping applicants from hostile nations like North Korea and Afghanistan without an in-person interview. So that's not acceptable. Number two, the province of Quebec has seen an inordinate explosion of asylum claimants, many of them false, because the government has still not put in place more tightened restrictions to prevent illegal border crossings. Point number three, this measure today will also reduce the incentives for people to continue to abuse the system. If people know that their asylum claim will be rejected and they won't receive premium health benefits, less people will be inclined to continue to abuse the system. That's why this measure is needed, particularly for the province of Quebec.